There are various vulnerable groups in Kenya, which include women, children, discordant married couples, truck drivers, youths, injecting drug users, commercial sex workers, to mention but a few. These are groups that are exposed to the risk of being infected with HIV and AIDS. Discordant Couples of Kenya, DISCOK, is an organization that seeks to impart knowledge into the peer educators who will in turn pass what they have learned to the most at risk in the population.
Today's event is mainly to train peer educators. In our organization, we have organized such that within our areas of coverage, we have the people on the ground who go out and meet members of the communities. Since they're the people on the ground, they know the people they live with. So we empower them with the necessary skills and knowledge about HIV and AIDS to go and train and educate the people they live with in their communities.
Among the risks that the vulnerable groups have are poverty, peer pressure among the youth, insecurity and rape for women and children, pornographic movies, negligence and long journeys in the case of truck drivers, which alienates them from their marital intimacy.
When we're talking about MAPS, we are talking about the most at-risk populations that are marginalized, by society. And also, among other issues, probably economic situation, political situation, and things.
The function of these peer educators from the western part of Nairobi who attended today's meeting will be to identify and educate the risk groups in the country. They will also enlighten them on the services that are available, which will enable them to reduce the HIV/AIDS prevalence.
The services are like condoms, distribution of condoms, services like healthcare, services like sexual and reproductive healthcare, especially for commercial sex workers, services like rehabilitation for drug users. Due to stigma and discrimination, they are afraid to come out, and probably access some of these services that are available.
The consultant of Discordant Couples of Kenya, Mr. Imoli Hanyula, has no doubt that after this workshop, the peer educators whose turnout is quite motivating will do a good job.
Now the whole intention is to curtail the spread of HIV and AIDS. So we are working towards the bigger picture of helping the affected and the infected, with the whole concept of eventually reducing on the number of infected people in the whole country at large.
Kibera TV, Nairobi.